when you expose a patient to that type of treatment and that type of communication, right? They don't want to go back to anything other than that. And you quickly realize that patients don't want to see you as much as we think that they do.
How do you make a decision on technologies? I know you said you're a DM user since May.
Yeah.
I started in October, but is there something you do to help you decide, yes, I'm going to do that?
Personally, I think the thing that's most important to me is surrounding yourself with people that think outside the box and have great ideas. Personally, I'm a dreamer, but I look to other people that have come before me and what their successes and failures have been. And that's what led me to dental monitoring in the first place. But I think, in the future, in order to continue to thrive in orthodontics, you're going to have to be digital. Chris Benson talks about that quite often. And I think, the more and more that we can utilize technology, whichever way it works into your practice, whatever company it may be, whether it's clear liners or customized brackets, dental monitoring, in-brace, whatever it is, you have to see what fits your culture, your vibe, and your team, and go with it. But I find myself to be rather impulsive. I don't know how you are. I think the level that we've done this with dental monitoring to the point where
dental monitoring to me there's a few technologies that we are engaging. They all have to surround, for us, a patient-centric modality. That's one of our first litmus tests. If it solves an issue for our patient, like this
100%.
Because we talk about saving an appointment time. And when I was in school, it was really good because I had an operations professor that talked about, he asked me one time, because he did a lot of toy manufacturing systems, Kaizen theory, in healthcare settings in hospitals to try to find reduction in variance of appointments and things like that. And when he asked me, he said, how long is your average appointment? After we talked and he learned a little bit more about our industry, I said 20 minutes, or 20-minute appointments, 20, 30-minute appointment. He goes, that's not right. I'm like, yes, it is. He goes, okay, I want you to go back and look at that. So I went back and I actually measured 30 appointments and with a stopwatch. I was like, no. In my team, from the time they walk in the office to the time they leave, it was 19 minutes and 32 seconds. He goes, no. I was like, what do you mean no? I just measured it. He goes, no. And when I came back again, I realized what he was talking about. The average appointment time for my patient was 60 minutes. Because they had to get in the car, go stand around for a tap on the head, your aligners look good.
Yeah.
And that was 7 years ago when I knew, I was like, I've got to do something different. Yeah. The marketplace really wasn't quite ready at that point. I didn't think they were for me to say, I'm not going to see you. Yeah. But when COVID happened, like most people, this company itself has really developed since then, because now our society, I'm more apt to say, can we just Zoom it? Do I have to actually sit in your waiting room and come in? And I know that other patients would appreciate that. And that was the real piece that pushed us to really move into dental monitoring. So like you said, there's still a cost. Yeah. So how do you justify that? How did you justify that?
There is a cost. And, when it comes to evaluating these technologies and what you're going to use and what not, you have to look at the ROI both from a quantitative and a qualitative standpoint, right? And I look at it kind of like a feedback loop. In the sense that we need patients to give us income in our practices, production and collections. And if those patients have a raving review or have an amazing experience because we had that patient-centric approach to our technology, our utilization, and our teams, our culture, and our practice, you're going to in turn see more growth. And we need to account for that growth in some manner, right? And dental monitoring helps us to service our patients, provide top quality care with a really nice personal touch, or we can interact with them from home. Like you said, that 20 minutes easily turns into 60 because we don't realize how much time they're taking out of school, work, sports, all of that. And it just adds up quickly. And to me, the ROI there is both from a money standpoint, from saving appointments, but really giving that care to our patients that they deserve. And in turn, they send more patients to our practice.
Right. I mean, it is a nice feedback loop. I kind of went a little geeky on it. I actually built a spreadsheet.
Yeah. See, I hang out with smarter people.
Oh man, that's cheap. It's like a canvas.
Yeah.
Artistically create. But I need to prove to myself that this is really a big deal with the increased costs, because
Yeah.
you've probably I've been doing orthodontics about 18 years. You maybe not that far behind me. Hopefully you are. But even when I was in school, there was a lot of companies talking about, if you buy this bracket, you'll have less appointments.
Yeah.
We're still talking about less appointments 18 years later. So
Yeah.
I guess it moved the needle, and maybe I've just gotten immune to what it was before, which is true because our appointments are longer, but I feel like that's kind of missed.
Yeah.
I feel like that's kind of run its course, which is good. We've grabbed a lot of efficiencies out of those and increased cost of those type of brackets, but I was looking for something else to help. And then being able to look at the profit per visit, just essentially using a little bit of math to say, here's your average selling price, here's how much your lab fee is. I just looked at maybe a liner case and cases, and then how does the other overhead work itself out? Even with DM, there was a large increase in the profit per visit that we could see.
Yeah.
And that's when I was like, I'm in.
I think if you're not evaluating your fee per visit and doing a D-band analysis, you're really missing out, right? The ROI, you can't justify the ROI if you don't know what your fee per visit is on each case. And looking at that, you'll quickly realize that by saving one appointment, your profitability is incredibly increased. And you're going to save way more than one visit when you integrate DM into your practice. But I mean, I guess that brings me to another point. When you're going to scale this, how did you go about it? I mean, to me, it doesn't make sense to dabble. You have to jump in. And that's kind of where I say my impulsivity kicks in. Oftentimes that gets me into trouble, but this time it worked out because dental monitoring has really opened up and freed up our schedule to be able to provide convenient appointment times for people, which has been my stressor for the last year and a half in my practice. I mean, do you use it for everything? Do you use it for obs too?
I started using for aligners and braces. My motivation to start with everything active treatment was, if we're going to be in a zone of low, if we're going to be in a mindset of a lot of support from DM, if we're going to be creating systems, let's look at all of it at the same time. It's equivalent to, we send the patient to get wisdom teeth out. Don't get two and then go back later and get two. Just do it all in one day. Yeah. And that was kind of the pain point we looked at, is if we're going to be really digging into this, we're going to really be having the same number of meetings, the same number of opportunities to learn with aligners and braces as we were with just aligners. So we decided to go all in for that reason, and really because of the patient-centric approach, which was really why we chose it. And doing just a little bit didn't make sense to us.
Yeah. I look at it the same way. I think that if you're already going to be in that mindset and you've already determined this is what I want to do with my practice, maybe you've already decided you're going to do braces and aligners or just, everything. Once you get over that hurdle, it really doesn't make sense to kind of pump the brakes and stop it at one modality of treatment. To me, like I said, the custom tailored approach for those patients, it's realized with aligners, but it really gets ignited when you put braces into it, right? With wire passivity, a load side of thing like that. And you are now taking away, I mean, no two patients are the same, so why should our wire interval changes be the same, right? Why is this predetermined 8 or 10 or 12 week interval for every knife type wire?
Options to do it.
I know. And that's what I'm saying. It's a totally different mindset. Yeah, now we do, right?
I don't even think we talk about that, but the fact that I have a central platform on my phone that I can communicate directly with patients on, and patient-specific items is great. I've really enjoyed that immediate feedback.
Yeah, I think that goes back to the patient experience too, right?
It's huge, yeah.
For me, I remember, being a second-generation orthodontist, I always had this protective mentality about, orthodontics in general. And so when I first learned about DM at AO years ago, my immediate gut reaction was, I don't like this idea. I don't like the AI. I don't like, I'm an orthodontist. I want to see my patients in my practice. And then last year, in an Orthopreneurs RD webinar that Dr. Alyssa Carter did for us, it immediately that night switched my viewpoint on it. And it wasn't that I was seeing my patients less. It was that I was evaluating them more, providing them a convenience of not having to come to me, and being able to communicate with them more, like you said, in that central platform. If I happen to look at it on the weekend and there's a patient that's having an issue and I can alleviate that, that immediately wins them over, and they're going to go and tell other people about how awesome this experience is, right? You know, when you expose a patient to that type of treatment and that type of communication, right? They don't want to go back to anything other than that. And you quickly realize that patients don't want to see you as much as we think that they do. And I think it's very interesting that more patients don't think that way, because I always thought that way. And it wasn't until I heard Dr. Carter speak about it and how amazing it was for her practice that I finally flipped over to that side and realized that since COVID, people have started to reprioritize their life and are making more time for themselves, their family, and their leisurely things, and they don't want to be coming to see an orthodontist at all.
At the end of the day, in our office, DM is truly to help the patient experience, to help the patient not have to come as much.
Yeah.
But if you do have that patient, like your dad was talking about, and my uncle talks about, they really want to see me. Okay, fine, then they really want to see you.
Yeah, but no, they
can still come see you. But this just helps those people that maybe don't.
Exactly, and it's not. I think that's what took a little bit of time for me to come around to DM, and when I made the decision after that webinar, you realize it's an adjunct to our treatment. It's not replacing our treatment.
Right.
We still have the ability and the capability to see those patients every visit if we wanted to, or if they wanted to, but we don't have to. And so it gives them that, like I said, it goes back to custom tailored treatment approach. We see them when we need to see them, or when either of us decide we want to see them.
Right.
Right. It's not a rigid scheduling protocol, just like our traditional treatment approaches have been.
So let's say something happens, DM, God forbid, there's a problem and they have to shut down and there's no monitoring. What are your thoughts on having to go back to the traditional way we were doing it 2 years ago?
I would be floundering, quite frankly. I came on the DM at a time where our practice has grown pretty significantly, and we were absolutely maxed out chair time and scheduling and appointments. It was bad, right? We are a practice that prided ourselves on the utmost quality of care, but also incredible customer service, and we were maxed out to the point where our treatment intervals were embarrassingly bad because we just couldn't service the patient load that we had. And so would I go back to the old way? No. And I think quite frankly, the better question is, could I? And the answer is no to that, right? It would severely impact our reputation and the quality of care that I'm providing my patients. Yeah.
Now that I experienced and allowed our patients to experience the difference and the ability to see and learn so much data and information about how I'm practicing, the feedback loops, the specificity of being able to bring people in at just the right time, whether a tray's not tracking and it's time to switch and they wear another 10 weeks of trays, or a wire's ready or a wire's not ready.
And once
I would have brought you back at 10 weeks, but you're not ready.
Once you see what you're missing.
Perfect. So
once you see what you're missing too, right?
I would not want to go back to the traditional way that I was doing.
No. And
I would feel blind at that point.
Yeah. No, I think it's kind of, I look at it like we use CBCT. I don't know if you do, but I think I couldn't go back.
It'd be hard.
And this is the same way. Once you see the more information, you can't say, I'm going to close my eyes to that information. It's there.
Right.
Right. And then in addition to just the platform and treating patients, we have insights, which allows us to become better orthodontists, enables us to become better orthodontists if you take the time and the initiative to study your insights data, right? So I think it's not only a treatment platform, but it's a educational platform for ourselves and for whoever's using that data appropriately. You can dive into whatever nitty-gritty details you want to, and then learn more about your faults and where you're not the best orthodontist and where you have room for improvement, or maybe which assistant isn't isolating certain teeth properly. You can start to pick up trends and learn and grow from it. So there's a lot of potential with dental monitoring in addition to the treatment delivery aspect, indirect treatment delivery aspect.
It's the first brutally honest clinical quality management system.
Yeah.
Because the pictures aren't going to lie. The trends aren't going to lie.
Yeah.
I mean, you can say the AI is off, but you can go back and look at the pictures that are there and say, okay, maybe I didn't get that quite right. Or maybe I did. Or here's what's working well. Or nope, that tooth wasn't tracking. You know, or maybe this attachment could be better. I mean, so many opportunities to learn. Like you said, if you look.
Yeah, if you care to look.
Still gotta look.
Yeah. I couldn't agree more.